Okay, let's talk about abdominal muscles and some soft tissue landmarks. So here is our abdominal x-ray. This is most likely a KUB. What you will learn about in positioning also is that a KUB is a picture of the abdomen, specifically for the kidneys, ureters, and bladder. And that's why it's called, kidneys, K, ureters, U, bladder, B. So it's called a KUB. On a KUB, we always have to include the pubic symphysis right here. This is a symphysis is a joint, and this is where the pubic bone here is joined, so it's pubic symphysis. Anyway, we always need to get that on a KUB, and also what we want to see is, and this is what tells us if technique is good, and it's also just part of an abdominal x-ray that we see, is this muscle here, which is the psoas major, or we just call it psoas muscle. And the arrows are pointing to it, but I'm going to, highlight it anyway. I'm not great with the mouse, but there you go. Okay, so let's move on to the next one. Let's see if it erases my... No. Okay, give me 1 second so I can erase all these pen markings. Exit drawing. There we go. Now, digestive tract, let's see, we have the alimentary canal and accessory organs. And let's run through some of those. So, oral cavity, we talked about that a little bit. We have the oropharynx. We have the nasopharynx first. Then we have that oral cavity, oropharynx, and then laryngopharynx. Now, the oropharynx and laryngopharynx are common to the respiratory and digestive systems, because that's a passageway that both air and food contents can travel before we hit the area of the epiglottis, where it closes off the trachea so we can swallow food and water, or it opens so that we can continue to breathe, that epiglottis there. So the esophagus is located in the mediastinum. We talked about that together. Mediastinum is pretty much anything here in the center of the thoracic cavity. It includes the heart and great vessels, esophagus, thymus, things like that. Okay, let's keep going. Now, first up, we have the stomach. This is a hollow muscular organ. Remember, we're dealing with epithelial tissue that we talked about a little bit for organs such as the stomach, but we're also talking about muscular tissue. It's an expandable reservoir, and if we go back to our medical terminology classes, we have the word gastro. So from now on, when we're talking about gastro in medical imaging here, we're talking about something to do with the stomach. Small intestine is next up in the process of, digestion. So we swallow something, food, water, what have you, goes to the stomach first. Then it's going to go to the duodenum, jejunum, and ileum of the small intestine. And it's in that order. So the duodenum is the shortest and widest part of the small intestine. It comes right after the stomach ends. Those two connect. Then we have the jejunum. That's 2/5 of the small intestine. We're going to look at how to differentiate between these on an x-ray here in a moment too. It has a feathery appearance on a radiograph. Ileum is the distal 3/5, and you can see it has a more solid appearance on a radiograph. So let's take a look. Here we have the stomach. We're going to learn more about the fundus, which is filled up with contrast right here. So I'm going to go ahead and put, let's say F here for fundus. Then we have kind of the body of the stomach here. This is kind of the body of the stomach. No two people have the same looking stomach, and it never looks like an anatomy illustration. It just doesn't. So we have to be really familiar with the anatomy of the stomach and so on, so that we know what we're looking at, even if it doesn't look like a perfect representation or like a perfect illustration. Up next is the duodenum. And specifically, we usually see a little bump here that starts with the duodenum. Here's the duodenum itself, but that little bump there is the duodenal bulb. And the A here is pointing, again, to the duodenum. Now, see how it looks kind of feathery is a good way to describe it, but it looks like it has maybe more air in it, let's say, especially compared with this. This looks really solid. It just doesn't look the same as this area up here, right? Well, that feathery appearance is what we were talking about up here. The jejunum, right? Looks feathery. So if we were going to take a look at this x-ray, if we got this on a registry exam and they asked us to point at the jejunum, we would say, I think the jejunum is letter B, represented by this feathery portion. Further into the abdomen, this is, and hopefully I'm going to give you just a second to think about what plane this is in. And hopefully you said coronal in your mind. This is a coronal abdomen CT showing a very large tumor or mass here in the abdomen. Just something, that we see in imaging. I'm going to go ahead and end here, and on the next video I'll pick up here in the large intestine.